This Cincy Lifestyle Health segment, sponsored by Mercy Health.
When it comes to your health, a primary care physician is your first point of contact for well visits or if you're sick, and they can help coordinate your care if you're seeing multiple doctors. At Mercy Health, they're expanding to make sure you receive the comprehensive care you need where you live.
I'm Joseph Kirchner. I'm a family doctor working with Mercy Health. I've been with Mercy for about 2 years, and I provide direct primary care cradle to grave, so from birth up until death. From my perspective as primary care, if somebody comes in and they don't have a PCP and they see the urgent care and I don't have any openings that day, after they're done with their urgent care appointment, they can say, well, we've got this doctor next door, he can take over for any future needs that you may have. They establish with me. Turns out maybe, okay, now we've got a heart murmur they didn't know about. I can walk them over and then get them established with cardiology, or vice versa. Sometimes people will see a cardiologist and they don't have a family doctor. So having all three of those kind of allows people to get all of the care that they may need in one more convenient location. With Kings Mills close by, I think having a location in this area really does help with patient access. Having both primary care and urgent care next door and very close to that hospital, it just expands our access to the local community and helps them get the care that they need. Primary care, we try to take care of as much as we can by ourselves. Anything from run-of-the-mill, colds, asthma flare-up, flu, and then if you have more chronic conditions, diabetes, high blood pressure, high cholesterol, chronic pain, whatever the case may be, or just annual checkups, sports physicals. Sometimes it feels like I'm kind of more of the coach, just trying to get everybody to cooperate, and they'll ask me, okay, well, what is, my kidney doctor said this, what does this mean? My heart doctor said this, what does this mean, kind of a thing. Or just a patient has a concern and they don't know who to turn to, they don't have a doctor, so they establish care with me and they say, well, this is going on, should I see a specialist or should you take care of it, or what's the deal there? So then I try to help them through that process as best I can. And having a hospital nearby is very convenient. I mean, if you establish care or you're following up and you need labs, imaging, referral to specialists, being able to go to a nearby hospital and get all that done is great. We can get you taken care of more effectively by having those hospital resources nearby. I think having this practice here will allow people in the surrounding communities, Lebanon, Mainville, Loveland, as far north up into Dayton, Beaver Creek area, if people want to establish here. And I think having this presence, it really helps Mercy expand its goal of providing that comprehensive care. Urgent care is open throughout the week. I am only here from Tuesday to Friday typically. I'm also in the National Guard, so I keep that day off in case I have a 3-day drill weekend or whatever the case may be. So I am accepting new patients once again from birth until end of life. Helping to provide that care to people is really what it's all about.